If you've been told you have the ApoE4 gene that puts you at risk for Alzheimer's, or you think you may have it, most likely your doctor told you there's nothing you can do. But that's not entirely true. Today, we'll share the 9 things you can do to reduce your risk of Alzheimer's.
I am Dr. Shabnam Das-Kar, a functional medicine doctor and a certified Tiny Habits coach. I teach people how to improve their focus, get rid of brain fog, and reduce their risk of dementia.
And I'm Andrea Spiros. I'm a behavior design consultant and professional speaker. I work with organizations to harness the power of high performance habits to increase engagement, resilience, and well-being. Today, we're talking about the ApoE4 gene, what it is and why you might be concerned. But also, we're really going to get to the 9 things you need to do or can do to support you in reducing your risk of getting actual Alzheimer's. So talk to us briefly, Shabnam, about the ApoE4 gene.
So the ApoE4 gene, there are 3 different kinds. Sorry, not the ApoE4, 3 different kinds. The ApoE gene are 3 different, ApoE2, 3, and 4. Now, I don't know why there is no ApoE1, but anyway, if you have a single variation of the ApoE4 or 2 variations of it, you are at a much higher risk for Alzheimer's disease than someone who doesn't have. Now, I want to make this very clear. ApoE4 is one of the genes. Now, Alzheimer's disease is, dementias like Alzheimer's. Alzheimer's is just one type of dementia, the many other types. There are multiple genes for dementia, but the ApoE4 gets a lot of, prominence because it is quite common. And most importantly, this is what Andrea and I always talk about, is your genes do not decide your destiny. So how do you get the ApoE4 or the ApoE gene? You get one copy of it from your mother, one from your father. So even if your parents have, let us say they have one copy, and you have your 4 brothers and sisters, maybe one brother or sister has not got any of them. Another one might get 2 copies of it. A third person may get 1 copy, and a 4th person may get 1 copy. So it's different ways of inheriting it. And again, it would depend on whether your parents have 2 copies or 1 copy. If they have 1 copy, they may give it to you. They may not give it to you. If they have 2 copies, obviously they are going to give you 1. So I guess it's sounding very complicated. Bottom line is, a lot of people get very, stressed about this whole thing, whether they should know about their ApoE4 status or not. Maybe they are suspecting that they might be having, or their parents, if their parents have dementia. So the bottom line is, it's different things for different people. Andrea, you and I have talked about this with Julie Bergfeld in the previous episode, and she is someone who lives with the ApoE4 gene, and she shared all the different things she does. But again, it bears repetition. If you have either 1 or 2 copies of the ApoE4 gene, it is not absolutely certain that you will have dementia. You
Exactly.
can change your risk. That is the most important message we want you to go away with.
Yeah, if you just stop listening right here and all you took away was you can change your risk, that would be fantastic. Obviously, we'd like you to continue listening to have some practical actions that you can take to actually reduce your risk. And do you want to talk about those now in terms of what are the 9 things you can do? Why don't we dive in a little bit to the 9 things that you can do to support yourself? Some of these you already know, and we're going to cover those briefly at the beginning, because there's a lot that's out there and you probably know the first few. We're going to go into a deeper dive on some of the ones that you may not know. And we're going to encourage you to pick things as you're listening that you think you can get yourself to do, and then actually take some steps to that. You don't have to do everything here. Just start with the things you can get yourself to do, and then you'll be moving in the right direction. So
Yeah, that's a very important point, Andrea, because one question that we get very often, should we test for, if I am suspecting I could be having it in my family, should I test for it? So the question is, if you know you have one of the genes, one of the variations, are you going to do something about it? So you need to decide before testing whether you would like to do something about it, and what you can do is what we're going to talk about today. But if you decide that you don't want to do anything about it, then perhaps it may not be a great idea to get tested either. So it's an important decision that you need to take, and you need to have a conversation with someone who will understand and help you go through the whole process. So
exactly.
uh, Andrea and I have talked about the three foundations of brain health: optimal blood glucose, optimal blood pressure, and low levels of chronic inflammation. We have multiple episodes talking about those things. So those foundational things are equally important in someone with ApoE4. And I will keep saying ApoE4, it means both one or two variations. Those people who have two of the ApoE4, they are at a higher risk than one with a single one. So those are actually even more, the foundations of brain health are even more important for people with the ApoE4 gene. And the next thing is, Andrea and I have talked about sleep and the food you eat, movement, mind-body interventions. So we have multiple episodes on sleep. We already have, I think, about 4 episodes.
Yes, 4 episodes probably on sleep alone.
So
And
all those things are equally, or actually, I would say even more important for someone who is at a higher risk. And movement, of course, we had a wonderful episode with our fellow Tiny Habits coach, Jeff. So those are basic stuff that I'm sure most of our audiences heard about them from not just us, from I think almost everyone who talks about brain health.
right out in the wild. So the first thing you can do is pay attention to the foundations of brain health, your optimal blood glucose, your optimal blood pressure, and to keep low levels of inflammation. The second thing you can do is pay attention to your basics, your sleeping, your eating, your moving, and then your the mind body piece, right? And then the third thing you can do, which most people aren't really aware of, or they've only loosely heard of, and then they may not know what to do, is supplementation. So let's
Yeah.
talk a little bit more about that.
So supplementation, when we talk about what is called therapeutic supplementation. The therapeutic supplementation means, and again, this is sort of like the idea that I like to talk about, is it is using supplements at doses which have shown benefits in research. So when it comes to supplements, there is something that all of us, a certain level that all of us need, which are called the RDAs, recommended dietary allowance. Now, recommended dietary allowance came up at a time when we were dealing with severe deficiency diseases like scurvy and rickets and all those. We don't deal with those diseases nowadays, but the RDAs were not reviewed after that. So here we are talking about supplements at doses which have shown benefits in research papers. Now, there are multiple supplements we can think of, but the three primary ones that I absolutely want to highlight. Number one is omega-3 fatty acids. Now, omega-3 fatty acids, the good thing is we can actually test for levels of omega-3 fatty acids in the blood. It's a dried blood spot test. And in the show notes, I'll add the name of the company in the US which does it. And in many countries in the world, you can have that kit ordered and you have it shipped home. So omega-3 is, when it's tested, it is represented as a percentage. Now, studies have shown that people with the ApoE4 gene need a 10% level of omega-3s. And the rest of us who don't have the gene, we can do quite okay with 8 or 9%, but 10% is necessary. Now, is there a way to know whether you have high levels of omega-3 without testing? No. So even if you eat fish every day, you eat salmon, breakfast, lunch, and dinner, even then you cannot get enough omega-3 from only food. And salmon is not the only source, for omega-3. There are others as well. So here is where adequate supplementation is very important. So the best way to know how much omega-3 you need to take is to get the testing done. And if you are not on a supplement at present, so this is what I tell my patients, Andrea. If you're not on a supplement right now, maybe you want to defer the test to 3 months after you start supplementing, so that you know exactly how much you need. Now, again, there are some, we'll talk about omega-3 on a separate episode. For people who have atrial fibrillation, you need to be very careful to take high doses. So I'm not talking about taking high doses. And anyway, none of this is medical advice. This is information for you to, understand the nuances.
Exactly. And really, what we want to encourage you is now, Shabnam is a doctor, but she's not your doctor. So
Yeah.
definitely run everything we're saying through your professional preferred licensed, whatever your healthcare professional that you prefer to work with, run it by that before you take any advice, because like I said, Shabnam is a doctor, but not your doctor.
Yeah, so omega-3, ideally get the levels tested and find out. So omega-3 normally comes as an EPA and DHA, and higher DHA level is better for the brain. But interestingly, none of these supplements work all by themselves. So a very important study came up a few years ago called the VitaCog study. What they found in that study is, for those, so this was a study on giving vitamin B supplements and omega-3s. What they found is B vitamins worked better at reducing something called homocysteine. We'll come to homocysteine very soon, in those people who had a higher omega-3 levels. So again, supplements, one single supplement doesn't work in isolation. They all work like a symphony. So just taking a lot of omega-3 while you're still deficient in vitamin Bs and Ds and iron, it's not going to work the same way. So there are no single magic supplements. Andrea, I'm asked so often, tell me one thing I can take to help my
Right.
brain.
Everybody wants one thing to do. The secret is that there's not only one thing to do, there's probably a bunch of little things to do that are going to have a greater cumulative effect. I love the idea of the symphony, right? It's not like you can just have the horn section or the drum section or the violins or the violas. Those are all, you need all those to make a beautiful symphony, but one of them alone is not going to make the symphony, and they all have to be in balance. So to work together beautifully. So let's talk a little bit more about the VitaCog.
So the VitaCog was this, that, when they found that those people who had higher levels of omega-3, when they were supplemented with B vitamins, they did a whole lot better. Their levels of a particular blood marker called homocysteine, and homocysteine can be tested anywhere in the world. High levels of homocysteine are bad for your brain, bad for your heart health, bad for mood issues, bad for fertility, essentially a whole lot of things. So you don't want your homocysteine levels to be high. And one of the causes of high homocysteine is deficiencies in B vitamins. So B vitamins, again, it's a fairly innocuous vitamin in the sense it's a water-soluble vitamin, so very unlikely you're going to overdose on them, versus the fat-soluble vitamins like vitamin D, vitamin A. If you just take, super high doses, there are risks. So vitamin B, it's a simple supplement available, again, anywhere in the world. So vitamin B is very important. And the other thing with omega-3s is the brain takes about, 2 years to do a complete turnover of all the omega-3s in the brain. So sometimes, Andrea, I find patients who'll say, oh, I'm just going to take the supplement for 3 months.
Yeah.
And what will happen after 3 months? Like, you're not going to get the omega-3s from your
Suddenly, magic will happen after 3 months.
Yeah. Sometimes I say with divine intervention, it's going to remain high.
Yeah, all of a sudden it's going to tip the balance. Right. And I think the thing with the supplements is sometimes we see the benefits, sometimes we don't see the benefits, but we probably are benefiting if we need them. Right. We all of us want this magic switch to be like, oh, I took my vitamin D today and suddenly I'm full of energy and I feel 20 years younger.
Yeah.
Right. But maybe what happens is over the course of time of taking your therapy, therapeutically supplementing, you do have more energy, but you don't necessarily see from day one to day now because you've moved through it so gradually. And most people don't go back and look at like, oh, 3 months ago, I really was foggy. We take our current state of health for granted. So taking them for a while, as you say, is important because the brain does take how long to turn over?
2 years, at
2
least in
years.
studies, yeah.
Yeah.
Another important supplement is vitamin D3. And again, there is you'll read, one day you'll read, oh, vitamin D3 is very important for blah, 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 blah. Next day, oh, you don't need to supplement with it. So I just want to clarify here. Vitamin D, when they have done studies where they actually measured the level of vitamin D before supplementing and they measured the levels after supplementing, those studies have shown that it is beneficial for not just brain health, because vitamin D has multiple actions in the body. But believe it or not, Andrea, there are many studies where they actually did not really test the level of vitamin D in the blood. They just put everyone on a single dose of supplement.
Uh,
And obviously, everyone is not going to reach that optimal level of vitamin D,
right.
and they are not going to see the benefits. So the thinking is, oh, you don't need vitamin D. No, it's not that. When you measure vitamin D, and again, vitamin D can be measured anywhere in the world, how much you need to take, the dosage will depend on your baseline levels. And even if you spend the entire summer out in the sunlight, sunbathing with minimal clothes, you will still not always make enough vitamin D. And particularly, with darker skin color, how far away are you from the equator? A lot of factors. In fact, we'll do a separate episode on vitamin D, I think. And
I think that'd be a great episode. So
yeah.
since we've referenced, we've kind of dipped our toe into homocysteine, why don't we talk about homocysteine next?
So homocysteine, again, like I said, it's a blood test. It's a serum homocysteine, and higher levels of homocysteine are a risk factor for heart disease, dementia, mood issues, reproductive issues. And as I mentioned before, the commonest reason is B vitamin deficiencies. Now, if you have already corrected B vitamin deficiencies, then you need to go to the next level. There are some genetic variations and things like that. So again, you need to meet someone who understands, because homocysteine is, considering that it's such a simple test available everywhere in the world, it's a surprise that, not a lot of people get this test done unless they've met a functional medicine doctor.
Right. So let's talk about a couple other things that people may not know. One of them, which is on our minds lately, you and me both, is mindset. Talk a little bit more about mindset and why it's important.
Yeah, Andrea, I was actually quite blown away by the research papers on how much mindset impacts our health. And since we're talking about ApoE4 today, so again, I'll post the links to the studies in the show notes. So they did a study where these were people with the ApoE4 gene, and they looked for what are called positive aging mindset. So how you think about aging? Do you think that getting older is a time of decay, and you're just going to be cognitively not functioning the same way, physical disabilities, joint pain, aches, you are not the same person as you were 20 years ago? Versus if you think that getting older is not the time for decay, it is not like, oh, it's just everything just goes downhill. It's not like that. So those are the positive and the negative mindsets about aging. So what they found is, if people had the ApoE4 gene, but they had a positive aging mindset, they did not have as much higher risk for dementia. Or this particular paper, I think, actually looked at cognitive testing. So again, bottom line is their mindset changed how the gene expression behaved. And mindset actually can increase your lifespan by almost 8 years, a positive aging mindset. Now, next point that, Andrea, you and I have talked about, and we are still exploring that, is how do we change a person who has a negative aging mindset to someone who has a positive aging mindset? I haven't quite figured that out yet.
Well, as you know, you and I have, like I said, this is always a big topic for us. One thing we know as tiny habits coaches is that sometimes just taking some action toward your aspiration can actually change your identity. So when we take people through the Tiny Habits 5-day program where they choose 3 tiny habit recipes and then do them with our coaching behind the scenes via email, oftentimes they have an identity shift, which to me is deeper than a mindset shift. But they also have mindset shifts where they suddenly see that they can form habits fast and that change is possible. So it gives them a hopeful mindset for the future, if not a complete change in identity as someone who can change and set themselves up for healthy aging. So while we know as tiny habits coaches, not everyone is the same, and matching yourself to the actions you can get yourself to take is one way that you can help with your mindset. And also just being aware of your mindset can start to help to shift that. There's no magic pill and there's no magic wand with that.
Yeah, and another, tiny habits recipe we were toying around with that day, Andrea, was, asking yourself, is this true? So let us say I feel, I have some joint pain in my left knee and my right knee is feeling fine. So first question very often would be, and I think I have a positive mindset. Now I know it is situational. Sometimes I don't.
No, mindsets are never 100%. So
No.
they can all shift.
So this is an example that Dr. Becca Levy in her book mentioned, that someone who's 85 years old, he goes to the doctor with, pain in one knee. And very often people are told, oh, that's because you're 85. But then his other knee is also 85. That one's not paining. So first and foremost, before you rush to the conclusion that this is because you are whatever age, 65, 75, 70, ask yourself, is it true? So if you feel that, you see the people around you, and sometimes you may find an example in a public figure, there is this very nice, and I like to show that picture to people, an 87-year-old salsa dancer, Andrea. She,
Nice.
it's very inspiring. It's like if we want to talk about physical disability because we are older, we should look at her videos.
Yeah. I will tell you that my dad played racquetball into his 80s. Now, I will
Wow.
also be very clear, he didn't he played a 40-year-old guy and there were 2 80-year-old guys, my dad and another guy against the 40-year-old, but he still played. And that kept his brain healthy and his body healthy, and he didn't take any medications up until a certain point he started taking a baby aspirin. But he had a very positive mindset around that. Let's talk about hormones now too, because there's a lot that can go on with hormones, especially with women, but men too.
Okay. Yeah, hormones are a huge topic, and we have talked about hormones and hysterectomy and hormones and brain health and other episodes. So number one is we know that more women than men have get Alzheimer's disease. Now, there was a time it was thought that because women live longer, so age is one of the risk factors for Alzheimer's. So that's why they have more Alzheimer's. But that is not the only reason. So lots of recent brain imaging studies have, they've found that women in the menopausal transition, so that means menopause is 12 months of not having a cycle, and the 8 to 10 years before that date is considered the perimenopause or the menopausal transition. So that means at that point in time, Andrea, women are much younger and they are not expecting to feel a whole lot of symptoms like, sleep issues, anxiety,
Right.
depression, brain fog. Suddenly, many of them are caught unawares because they were not expecting anything to happen so many years before menopause. And even their doctors are sometimes surprised because this information is not available everywhere. Thanks to a lot of awareness building these days, people are probably more aware, but there's still a large percentage of women who don't know that 8 to 10 years before their menopause, they may experience a whole bunch of symptoms. Now, going back to ApoE4 and hormones, So when they looked at brain imaging in younger women in the perimenopausal period, what they found is their brain glucose, the brain's ability to utilize glucose is less. But this is again not a story of just doom and gloom. When women were put on hormone therapy, and hormone therapy, again, it's a special, safe type of hormone therapy where they used estrogen on the skin and oral micronized progesterone. For details about what particular hormone therapy and all that, I would suggest that you listen to the episode on women and hormones and the brain. So women who used hormone therapy, they had a whole lot less of these particular, these are called amyloid beta pathway chemicals. So amyloid is again related to Alzheimer's disease. I don't want it to sound too complex.
Yeah.
Basically, the short form of this whole thing is those women who were on hormone therapy and had the ApoE4 gene, they had lesser of these amyloid, markers. And again, the other important factor when we talk about hormone therapy is the timing. So early hormone therapy within 5 to 6 years of menopause is found to be better than hormone therapy later on. Now, it doesn't mean you cannot take hormone therapy later, but it's better if you use that particular window. And again, I know it's sounding way more complex, but you need to have a conversation with your doctor about this. And some doctors may not be aware of the timing. And a lot of women are, given incorrect information that hormones are going to kill you and they're not for you, and you don't have hot flashes, so you don't need hormones.
Right, right. So do your own, find a professional that's a match for you, that's on the same page as you. That's really,
And who
really
knows about hormone therapy, because too many people are like discouraged to use hormones. I have studied hormones, so I have a very different, and I'm personally on hormones.
Yeah. So let's talk about things that a couple more things that are maybe you won't know or people don't generally talk about. What about head trauma? And
Oh,
most people are thinking like, okay, only professional sport players get head trauma, or I never really had I wasn't a rough and tumble kid, so I didn't really have I haven't had anything like that. Talk a little bit about head trauma and what it is and why it's important in terms of having the
okay.
ApoE4 gene.
That's a big one, and quite often people don't connect head trauma with dementia down the line. So, uh, head trauma in anyone who has the ApoE4 gene or doesn't have the ApoE4 gene places them at a higher risk for dementia years later. And the other thing that very often missed is sometimes it's mild head trauma. So in medical terms, it is traumatic brain injury, mild TBI. Now there is nothing mild about TBI at all. So if someone has not, been knocked off completely unconscious in a severe road traffic accident, it does not mean that head trauma of, falling from a stool while you're trying to reach a higher shelf, or
Right. Or banging your head as you come up on the kitchen cabinet really hard.
Yeah, so these are the what would be called mild TBI. Those are not so mild, and my suggestion would be if you are someone who's experienced that, do not ignore it. You need to meet someone who knows how to deal with any kind of traumatic brain injury. The particularly what people will say, oh, you didn't have you didn't lose consciousness, so you were absolutely fine, you just had a few headaches, you should be okay. It is not that. So that is, and how it in relation to the ApoE4 gene. So Andrea, just before we started recording, I was talking about, so a woman who has the ApoE4 gene, one or two variations, and who is in menopause, not on hormone therapy, and has head trauma, and is a heavy alcohol user, that is not a great picture. That
Right.
is,
It's just like we talk about with supplements. One supplement isn't going to suddenly boom, you're better. The combination of them can support you and they work in symphony to one another. The opposite is true too. If you have multiple, if you're not moving, if you're not sleeping well, if you're have a bad mindset, and in the scenario that you describe, and you have the gene, then you're more susceptible to Alzheimer's. Now, all is not lost. Just start where you are and you can turn the ship around. Let's talk about alcohol, since you mentioned alcohol.
So I'll be brief. The safest amount of alcohol is 0, and I love red wine, so it's not like it
No
applies to me
judgment.
too.
No judgment.
But yeah, so the thing is, if you know your ApoE4 status, let us say you know that you have either 1 or 2 variations, maybe you're going to make a different decision about alcohol. All those stories about red wine being beneficial for your, I don't know what it's supposed to be beneficial for. All that is not true. Not true. The safest amount of alcohol is 0. In fact, I think it was last year that Canada came up with a sort of a spectrum of alcohol intake rather than, are you a mild drinker, moderate drinker? And women and alcohol is again quite different. Because women have different metabolism, and alcohol is also important when it comes to hormone therapy, because higher alcohol intake and estrogen levels can go up and risk for breast cancer and the whole lot. So yes, and I think when it comes to alcohol, other than what we have done with cigarette smoking and making it socially unacceptable, I don't think there are easy solutions to, and I'm not talking about alcoholism or alcohol dependence. It's like,
No, we know that's a different issue. Really,
yeah,
if you have this gene and this is an area where you consume, you're drinking daily, this is an area where you may want to think about cutting back in order to support yourself.
yeah,
So
and more importantly, maybe alcohol is not the first thing you want to address. That is the other important thing. So, Andrea, what would you say from a behavior design perspective? Someone who's not sleeping well uses alcohol thinking that it's going to help them sleep, does not move, does not eat, the right food. Do you think they should start with addressing alcohol first if they don't feel motivated enough?
probably not. From a behavior design standpoint, I would say this is the question you need to ask yourself. First of all, you want to think about what's the easiest thing you can do. So if you think, I don't have a lot of alcohol. I don't have the gene either, but I don't have a lot of alcohol. But for me, if I had the gene, maybe I have a drink or 2 a month. For me, that's an easy place for me to start, to say, you know what, I just won't drink, right? That's a very easy place for me to start. If
Yeah.
I were different and I were having red wine daily with dinner, that might not be the place to start. So think about what's the easiest place you can start. And then can you get yourself to do that? Say, can I get myself to do this? And if the answer is yes, start there. Because wherever you start, you're going to build some success momentum. And it doesn't matter where you start, it's just that you start. Let's talk about the last thing, which was a sense of smell. And
yeah, that's like really interesting. And lots of studies recently have come up where they found that losing your sense of smell, or your sense of smell being less intense than it was before, is a risk factor for Alzheimer's. And studies have shown that people with the ApoE4 gene have this loss of sense of smell earlier than people who don't have the gene. Now, obviously, what will you do if you find that your sense of smell is going down? The interesting thing is there is something called odor training. And odor training means you basically sniff a bunch of stuff. That is one way. Another way is using essential oils. And there was a very interesting study where people used 7 different essential oils each night of the week, and they put it in a essential oil diffuser, so 2 hours every night. And I started doing that.
interesting. How's it working?
I don't know, because the fact is I should have done a brain test just before and another one 3 months later. But I thought, I have a diffuser at home which has a timer. I have a bunch of really nice essential oils. Why don't I start it? So the researcher who did that, I'll post the link to the paper. They are going to come up with an easier to use version rather than, opening and sniffing 40 bottles of essential oils.
Exactly. You don't have to do that.
No, just you can start off with, if you have a diffuser already, because their device has not yet come up. We are all waiting for it. So training your sense of and smell. The memories of smell are some of the oldest memories we have. So Andrea, if you think back, there are some memories. Like I know for sure one memory from my childhood is sandwiches. Now,
Yeah.
of course, I don't eat gluten, and we grew up eating a lot of bread. Like bread was our number one go-to because
Right,
it was
right.
so easy. And my mother used to make these really tasty sandwiches. And when I smell them nowadays, it reminds me of that time.
Yeah, it can really evoke memories. So
Yeah.
if you are noticing a slightly, decreased sense of smell, that is a signal too.
Yeah.
So
And again, there are tests available. There are some sniff tests that can be done. But again, it's not like you just, tell your doctor that I just want to do a sniff test. But
right,
it is available. My point is there are ways to figure that out. There are some sniff strips which you can do at home and figure out. Or if you are someone who can't smell the burnt toast or burnt food on the
right, and you'll know for sure.
yeah.
So we've covered a lot today. I'm going to review the nine things you need to know. So first of all, you need to pay attention to the three foundations of brain health: your optimal blood glucose, your optimal blood pressure, and having low levels of inflammation. Second, you need to pay attention to sleeping, eating, moving, in your mind-body practices. Third, we talked about therapeutic supplementation. Fourth, we talked about mindset. Fifth, we talked about hormones. Then we talked about homocysteine. Sixth, head trauma, and then alcohol, and then your sense of smell. And there's a lot of things you can try in here. Definitely seek out your preferred healthcare professional to verify what's the right move for you. And then think about, what can I get myself to do that's going to have impact towards supporting my system to respond better and not turn on the ApoE4 gene. So the ApoE4 gene is not a death sentence. You definitely have some agency. Your genes do not determine your destiny. And we've listed a whole number of things that you can do to support yourself in that. So thank you for listening. Please subscribe. You can find this and all the podcasts at drkarmd.com/podcast. That's drkarmd.com/podcast. Thank you for listening. Cheers, everyone.
Thank you.